Hi guys, welcome back to another video of your channel. So today's topic is from metabolic diseases, that is from veterinary medicine. So today's topic is actually Azoturia. So we are all familiar with this topic. So we will be looking about basic things of this disease. Please subscribe this channel and hit the bell icon for more updates. So the synonyms. The first synonym is exertional rhabdomyolysis. So next is tying up. Next is cording up syndrome of horses, paralytic myoglobinuria, and Monday morning disease. So we will be telling you why these names are given for this disease. So we can also call it as exertional rhabdomyolysis syndrome or ERS. And in general, it's actually a multifactorial myopathy condition, mainly affecting the work horses or the draft horses, and belongs to metabolic muscular disorder. So they belong to the muscular system disorder, and it is clinically characterized by stiffness in gait, reluctance to move, lameness, hardening of massive muscles, and in severe cases, myoglobinuria, that is presence of myoglobin and its components in urea. So we'll see how the myoglobin is coming to the urine. So this is actually the condition. So whenever the draft horses are given 2 days rest, but full working ration, and after 2 days, they are starting to move for the work or for the draft, they'll feel this exertional rhabdomyolysis condition or Monday morning sickness. So what happens? During exercise, the large storage of glycogen formed during the rest period in the muscles get metabolized to lactic acid, and they react with the sarcolemma and they form sarcolactic acid. So these accumulated lactic acids will degenerate the muscles and they will necrotize the muscles. So what happens? The degeneration and necrotization of the muscles will result in liberation of myoglobin, that is muscle hemoglobin. So this myoglobin will be liberated and this myoglobin will be present in the blood, and this myoglobin will be filtered out of the kidney, and this happens in myoglobinuria. So swelling of muscles will be there because the lactic acid is actually hydrophilic and they will be taking more water, and that will lead to swelling. So swelling of the mainly the gluteal and the femoral muscles, that is the sartorius, the quadriceps muscles, etc., and the gluteus muscles mainly. So the diagnosis actually through the history, the clinical signs mainly, the laboratory diagnosis that can be done by CPK, creatine phosphokinase, and AST enzymes. And we can also go for histopathology of the muscles, that is hyaline degeneration of heavy muscles. We can also call it as Zenger's necrosis or myonecrosis. This necrosis is actually happening because of the reaction between the sarcolemma and the accumulated lactic acid. So the treatment is actually the animal should be kept as quiet as possible, and we have to make many attempts to make the animal in standing position. And hot fermentation should be given, good nursing care, good mental care, and we should try not to prevent the development of decubital ulcers. Nervous, restless animals or those having evidence of pain should be given narcotic analgesics or chloral hydrate or some sedatives, tranquilizers like azithromycin or chloral hydrate, something etc. So moving to the clinical signs, in very mild cases there will be poor performance, whereas in mild cases there will be stiffness in gait, whereas in severe cases there will be profuse sweating, stiffness in gait, reluctance to move. So the horse will be assuming a dog sitting posture followed by lateral recumbency, laying down, and repeated attempt to rise, often with nervous signs. So this dog sitting position is actually due to weakening of the gluteal muscles, and due to the excess necrotized muscles will be giving pressure to the sciatic nerve and the crural nerve, and they are mainly supplying the hind limb muscles. So any problem or any pathological degenerations to those muscles will result in dog sitting position. So hardening of gluteal and femoral muscles due to more storage of glycogen and inflammatory reactions. Paralysis due to pressure on sciatic nerve and crural nerve. Rapid respiration, weak pulse, temperature may be rising to 40.5 degrees Celsius. Hard boat-like muscles, particularly of the hind legs, that is the femoral muscles and the gluteus muscles. And the myoglobinuria, that is actually passage of myoglobin through the glomerular filtration tubules and in the urine. That is dark red brown urine. So you can see this is the dog sitting posture in case of azoturia, that is profuse sweating and red colored urine. So treatment, so we have to go for sodium bicarbonate IV or oral administration. That is actually for alkalization of the urine, because whenever this myoglobin is present in the renal tubules, they will be taking more water and they will be starting to produce crystallization, and that can produce acidic urine that will be leading to much more nephritis, interstitial nephritis and tubular glomerulitis. So next is IV injection of large quantities of fluid so that we can ensure proper diuresis and proper elimination of the nephrotoxic methanoglobinic acid and other acidic products. Next is injection of thiamine daily. That is actually to increase the tolerance of the blood to lactic acid by increasing the lactic acid metabolism. That is, whenever we are giving thiamine, lactic acid will be easily metabolized and lactic acid cannot produce much pathogenesis problems. So for controlling pain, you can go for flunixin, phenylbutazone, or any chloral hydrate or tranquilizers, etc. So antihistaminics, vitamin E injection and selenium may be useful because vitamin E and selenium will be giving a soothing effect to the degrading muscle, and they will help the lactic acid metabolism to work in a proper fashion. Prognosis is actually good if the animal remains standing. That is, whenever the animal is sitting or going to lateral recumbency, the prognosis is very poor. And death occur in recombinant host due to decubital sepsemia or endotoxemia or myoglobinuric nephrosis and uremia. That is actually whenever the this myoglobin is going and attacking the kidney power will be lost. The filtration power of the kidney will be lost. So what happens? The urea, they get accumulated in the blood and the urea will be circulated almost all over the body. And this urea will be attacking and producing mainly uremic gastropathy, uremic enteropathy, uremic meningitis, etc. And this myoglobin, whenever they get deposited, they will be producing myoglobinuric nephrosis. Thank you.